Welcome back to this episode of the Strong Kind Podcast. This episode is with Dr. Austin Baraki. Dr. Baraki is an internal medicine physician. He's also a barbell enthusiast. He works with barbell medicine. He is a really insightful and knowledgeable healthcare practitioner. He's also a really strong dude. We had an awesome conversation around health, the complexity of human health, and how to move forward despite that complexity. And we also talked training, and rehab and pain and all sorts of awesome topics. It was really a great discussion with Austin. I hope you enjoy it. Check it out and let me know what you think. Thanks. All right, so I'm with Austin. Austin is you're an internal medicine physician, correct?
Yes, correct. Yeah.
Where are you at? You're where you're like at a teaching hospital, I assume, correct?
Yeah, I live and work currently in El Paso, Texas. Made
Okay.
my way here by way of my wife's military career that has taken us to a few different places around the
Okay.
country. So I've, lived and worked in Virginia, San Antonio, and El Paso, and so there's likely to be some more moves in my future. But yeah, I'm currently working and teaching out of a military treatment facility here in El Paso, and then I also work and teach at a local medical school, teaching preclinical medical students as well.
Super cool. One of the questions that I was really like thinking through, I'm sure you do a good job teaching this, but like I don't know how good of a job you maybe see other people doing like motivational interviewing type of
hmm
approaches.
hmm
I have never, I used to work as a nursing tech before I
Yeah.
went to physical therapy school. I was like a nursing assistant, and it kind of gave me insight into like what we would call bedside manner, like who does it well. Like my job was literally to like empty catheters, wipe
Yeah.
butts, take people to the bathroom, but it was
Essential stuff. Yeah.
it was honestly one of the best jobs because if I just did a good job with
Yeah.
like customer service, people were nice to me, right?
Yeah.
But then that was one of the things I didn't really realize it at the time, but like motivational interviewing, there were people who would come in and they would be like really chill and calm and they would ask questions and it like built a lot of trust. And then I would see people who didn't do that and I'd be like, what is going on here? Right. But I'm sure I know that from the barbell medicine, like just the general ethos, I suppose like that's a big part of how you guys approach things. But do you see it as widespread in clinical practice as you think you should?
Oh boy. Yeah, this is a huge topic, and the reason is that the context matters so much here. So what I mean by that is one variable to consider as far as like this concept of motivational interviewing, et cetera, is to your experience, it sounds like working in a hospitalized setting where you were dealing with catheters and IVs and other sorts of things like that. Patients are oftentimes very ill.
Yeah,
And there's a lot of factors that are impacting their medical situation, their sleep at night, their wakefulness, their energy levels. They might be delirious. There's all sorts of things. The hospitalized setting is truly a different world. And most people who don't spend time in a hospital or who aren't around like in an intensive care unit have no concept of what that's actually like. And so I see sometimes posts on the internet potentially just getting a rise out of people, but also people who think that they're giving a good hot take talking about like, well, we should be promoting like this very particular diet in the hospitalized setting or something like that. And it's like, well, ideally, the patient is in the hospital for like as little amount of time as possible. Whereas we know that the effects of nutrition on health, for example, are like this cumulative lifelong exposure kind of thing. And so what type of difference are we actually making on that front in the hospital? So the first question that I'm getting at here is if you are if your intent is to apply some motivational interviewing in the hospital, is it the right time to have that particular conversation, right? So
yeah,
I do sometimes bring up, depending on the patient's context, like discussion of exercise. And this most often has to do with when patients are, frail, debilitated, weak, unable to do their daily activities, in need of rehab. And I'm trying to build up some interest and motivation and, regaining some physical capacity. But if it's somebody who is like in active cardiogenic shock from their heart attack, probably not the best time for me to be having some of these conversations around, what the best diet is for them moving forward. I just need to keep them alive to get them out of the hospital to move on to the next step, right? So that's one consideration is like, is it the right time and context to be having this conversation at all? Now, with that said, it is always useful and valuable to be able to have skills and strategies and methods built into your practice that can establish better patient rapport, get better buy-in, establish that kind of therapeutic alliance with patients. So, I know that in my unit where I tend to work, both the floor nurses and then when I go into the ICU, they all know that like I'm the guy who when I go in to see their patient, they know to if there isn't a chair in the room, that I'm going to be coming out looking for a chair so I can pull up a chair adjacent to the patient's bed and sit down. That's the way I do things, which is apparently different than some other folks who go through those units. But that's something that I have, I observed when I was going through my training very early on, noticed the impact it had, adopted it, and I've impacted a bunch of my trainees to do the same. And that's a very simple thing that does kind of have an impact on that relationship, rapport, therapeutic alliance, etc. But I also go out of my way to do that and make the time to do that. And so
Yeah.
the other contextual variable here, aside from the patient scenario of like, what are they going through and is it the right time to be having that conversation, often overlooked is just like, it is very difficult to be a very busy, like acute care doctor, or even in an outpatient setting. Like the demands on your time, on your energy, on your attention, you are often getting pulled simultaneously in 15 different directions. I remember being a resident and having like 3 or 4 pagers on my waist, getting blown up at all at all hours, having to decide who needed my attention the most in that moment. And so those kind of scenarios make it even more challenging to go out of your way to do some of these things when you have all this time and all these demands on your time and attention that you have to be triaging. And so that at that point, I can see how some people might not be able to sustain that or do as good of a job at having the kind of conversations that people want when one patient's in one situation and might expect a particular level of service to your to the way that
Yeah.
you described it, when it's
Yeah.
like, well, the guy in the room next to you is like dying right now, I need to go take care of that, right? So
Yes.
I just this is a broad overview of just like all the variables, the patient side, the clinician side, and then kind of what it takes to do these things and sustain them day to day in practice.
Yeah, and I appreciate your nuanced take there, and I think like some of it in my brain was like I'm going to ask about motivational interviewing, but to some extent it's kind of like communication and decision making,
Totally.
right? That like nobody, because I got the job at the hospital with the intention of going to medical school, right?
Hmm.
And then I just shadowed a bunch of docs, and I just kind of like I just also, I think in hindsight's always 2020. Both would have been maybe great, right? Could have been great, right? Uh like did you do a whole lot pre-medical school in like a hospital or anything like that?
Um, the Not really. I had some peripheral exposure to other physicians, but I didn't go out of my way doing a ton of shadowing or other exposure. I was reasonably confident that that was the path I wanted to take. And then I did 1 year as a scribe working in an ER. I guess that was pre-AI days. Now that AI is going to take over all scribe jobs, and
Yeah.
they're all gonna lose their lose their
Yeah.
jobs in the current era. But by that point, I was actually already accepted, so I was already committed to the path. So that was the
Gotcha.
extent of my kind of pre med school exposure experience. But I was reasonably confident that that was the path for me.
Is there anything in like, and hindsight's always 2020, but like if
Yeah.
you could go back to like 22-year-old Austin who got accepted into medical school, it's like how, and like part of life is like you learn these lessons along the way, and that's what makes you where you're at now. But
Totally.
anything that you would be like, all right, or anything that you would tell like people who want to go to med school about your experiences, like, and this is really broad, so I'm not asking you to like,
Sure.
but in
Yeah.
your experience, like what are
Yeah.
some things that to take in mind if you're going into medicine, for somebody like like the 22-year-old versions of us who are contemplating it?
Yeah. Yeah. It
And
is
it's
a
not that
pretty
organic chemistry is super super important to your the
sure.
rest of you.
Yeah, I mean, you have to play the game. You have to,
Yeah.
do all the thing, check all the boxes. So yeah, I was a chemistry major. I was a big organic nerd, even though I don't remember almost any of it at this
Yeah.
point. I did what I needed to do on the tests. I beefed up my resume in all the ways that needed to happen. I got the board scores that I needed to be able to get into the residency that I wanted, et cetera, et cetera. I think about where I've ended up at this point in this particular field of internal medicine, which is by far the best match, for my brain and what I
Mhm.
like to do cognitively, much more so than like procedurally. I do a handful of relatively minor procedures, but that's not the focus of my job. It's mostly a kind of a cognitive specialty, which is something that I prefer over something surgical. But And then the other big aspect of what I do is education and across a full like 7 year spectrum of medical training from first year medical students all the way to third year residents. And then also doing some, collaboration and education among colleagues and peers and things like that. And if I had to pick which I prefer between the two, I actually prefer the educational aspect even more than like the clinical side. I don't like dislike seeing patients or actually treating folks, but I definitely prefer the educational side even to an even greater extent. And so, yeah, I see, I look back on my trajectory and it kind of makes sense. I've been teaching and tutoring people ever since I was like a early high school swimmer, trying to help my swimming teammates like stay eligible to stay on the team and stuff like that. And so there's been just this continuous thread of education throughout my career. And then the specialty was a particularly good match. So, advice, I think it's an enormous commitment. I think that you need to ideally you have a good sense of what you're getting yourself into. And so whatever it takes for you to do that. I had a good sense, even though I didn't go and spend an enormous amount of time, shadowing clinicians and interacting with them just through my own, I guess, I don't know, I wouldn't call it like research, quote unquote, but I had a sense of what I was getting myself into. That would be the thing that you don't want to get blindsided by that. Medical school is not easy. It's grueling. But residency is even harder. And so you have to get through that as well. And then what's on the other side of that? Are you going to be somebody who wants to work in private practice? Well, that can look a whole bunch of different ways depending on the specialty you're in. Do you want to end up in education? Well, there's some trade-offs there too, to keep in mind. And so, yeah, I think that going out of your way to interact with people at varying levels throughout their medical training and people who are out of medical training will probably be the best way for you to get a good sense of what you're getting yourself into. Meaning that if you're at this decision point, not necessarily just talking to somebody who's been in practice for 30 years, because their experience will have been very different than what yours will be going into the field,
Yeah.
right? So going through medical school, going through residency, 10 years ago, 20 years ago, 30 years ago was very different. So they have some valuable perspective for you, but I would aim to draw some perspectives from them, from younger physicians, from residents, from medical students. So it's going to require some effort, networking, I guess you could call it, to get a sense again of what you're getting yourself into.
Super, super helpful. All right. So I'm gonna ask the lifting question
All right.
associated with medical school and residency. You've
Yeah.
been lifting for like I mean, I remember following you. I don't even know. Like I'm 36. Like I might be older. I don't know. How old are you?
About the same age.
Yeah, so like I remember when barbell medicine first became a thing, to some extent. I kind of remember like, and this is all weird internet
Yeah.
relationship stuff, but I remember like the affiliation between starting strength and
Yeah.
you guys, and then, but like you've been lifting for a really long time, and I
Yeah.
think in training and putting out content oriented around it, but so much of just what I appreciate you about you is just kind of like how like laissez-faire or just fucking do it type you are, right?
Yeah.
Like, and how strong that has made you, but how hard was it to balance like um training and school, and it continues to be because like you're a busy human being and
Yeah.
you have other commitments and stuff, but
Sure.
I mean, how hard was it, but also like why did you keep doing it?
Yeah.
Because that's, like you and me are people that maybe you don't. I think you enjoy it. I think you have to enjoy it to some extent, right? But like, I enjoy going and moving my body and challenging myself. I've also like finally broken past like this idea that there's like some perfect program that I'm gonna found. It took me like 15 years. I think you got there a lot faster,
Sure.
which is like when you actually get to that stage is actually when I think you're on the precipice of actually starting to make progress. Is like,
Right.
oh yeah, okay, it's just freaking slow and steady progression with a lot of waves that you're going to ride, and doing consistent work that is challenging will get you a lot farther than thinking that there's some panacea of productivity. But how did you balance the rigors of your academic and and your career at this point, and then why have you kept up
Yeah.
kept up with it? Because you kind of
Yeah.
ascended to like, yeah, what else is there for me to do to some extent, right?
Yeah, certainly some commonalities it sounds like between us there. I mean, I grew up as a multi-sport athlete for for many years. I before kind of focusing more on competitive swimming for a long time through college. And so I've been active forever and enjoyed the training process. And so that, as far as my swimming career, I had some, I would say, moderate success. Like, yeah, I swam competitively at what is technically a Division I school, although not the fastest by any means at the College of William and Mary. And I did okay there. I think that I've become a better lifter than I was a swimmer, actually, in terms of like relative to the field, so to speak. But despite that, I always enjoyed the training process when I was in swimming, at least as much, if not more, than like actual meets and competing. I didn't, again, dislike them, but like the day-to-day process of working through it, getting better, et cetera, was very enjoyable and rewarding to me. And that's not something that, we necessarily choose. And so some of this I think is something about my wiring, the way my, there's some genetic influences on all sorts of behaviors and motivation and the things that bring you reward and things like that. So I don't know that I chose some of these kind of attributes that have facilitated success in these areas. But rather it's just kind of like given the right environment and resources that this is what will naturally emerge as a result of that, right? And so
Yeah.
that concept carries through when after I finished college swimming, um, I got a little bit more serious into lifting during that period, and then found that I responded well and enjoyed it, and kind of grew from there. As far as how it happened through medical training, it's kind of the same point of being in the right environment. And so I was fortunate enough to be able to live in a situation where I either had easy access to a gym or I was able to maintain a garage gym for many of the years, right? Including through all 3 years of my residency, and then for my first several years, in practice after finishing residency, maintained a garage gym. I still have one to this day. And I know that made a huge difference in terms of just reducing barriers to be able to stay, relatively consistent with training without having to take extra amount of time out of my day for, commutes to and from the gym and all sorts of things like that, which, you know, big picture, that amount of time is not enormous, but it still is just a barrier, right? So
Yeah.
just setting up my environment, my time, my schedule to whatever extent I had control over it with access to what I needed to do for a thing that I already enjoy doing. And so,
Yeah.
yeah, you're right that it was not terribly difficult to train when I enjoyed training. There was never a period during those years where I like dreaded the workout, or I walked into the gym and I was like, I have no desire to do this right now. It was almost always like, yeah, I am ready to do this. It might be tough. I might need to, abbreviate it. It might be condensed, modified, whatever, because I have a lot going on. But I want to do this because I know from my years of experience in the pool, like, yeah, not fun to wake up at 5 in the morning and walk across campus in the December to hop in a, 65-degree pool. But I always remember after I got out of the water, I was like, damn, okay, I feel like so much better
Yeah.
now. And you have like daily amnesia about this. They feel like the next
Yeah.
day it sucks all over again. And then afterwards you feel better. And so, I guess part of that reward I suppose that I get out of it is, yeah, training, doing stuff that's physical and challenging like this, and working through that process. It keeps me sane. And so,
Yeah.
I remember having some of my best training sessions ever during school, like right after a huge, course exam or a midterm or something like that. I have just like this enormous load off my shoulders, and then I'm like, okay, I'm ready to go, do a big lifting session or something like that. And just it was a good, I guess, coping and balance strategy for the stressors that were around me. It got a lot harder in residency because residency, your schedule is way less within your control, right? And
Yeah.
so I would be doing, sometimes 14-hour shifts a week or something like that, or I might be doing 24-hour shifts every 3 days for a whole month, or 28-hour shifts every 3 days for a whole month in the ICU setting, or I'll be on nights or days. It was just much more challenging, but I still found ways to essentially, on aggregate and on average over that period of time, not really miss training. It just had to be more flexible and modified in certain ways to keep doing it as long as I maintained reasonable expectations of what was feasible at any given time.
Yeah. The reasonable expectations piece is like huge, right? I think you posted something, it's like a Steve Magnus quote a couple days ago about like, yeah, he was talking about there's just no workout that's perfect, but the Steve Magnus thing that like comes through my mind is like happiness is realistic expectations, like, and like the happiness equation is realistic expectations and then like high like intentional effort or something like that, right? But like, yeah, I just think it's so, the interesting thing about like the dichotomization of like our mind and our body, and it's like I just always felt better mind body when I like I would study for a period of time and then I'd be like shit, I just like need to go move, and I
Yeah.
like, and a lot of my like and a lot of people around me didn't have that relationship when in like PT school, and they just like, yeah, you just start procrastinating your studying anyway. So I would just go and like cleanse my palate and come back and actually
Yeah.
be able to kind of like sit for another couple hours and do it, right? But that takes that takes like, yeah, kind of the conditioning and the, yeah, again, yeah, the environmental things. Like, I started running my sophomore year of high school because I wanted to make the soccer team, and I
Hmm.
learned, oh, like I honestly, I always say this, it's kind of an internal joke. Like I was like slow. Like I was speed wise, I was slow, but I figured out, oh, I could run 3 miles fast, which is what you have to do to make the soccer team
Sure.
and play. And it's like, oh, I can kind of do shit that other people aren't willing to do. And it made me feel good. Right. And like, so there's all these factors like that people kind of have to figure out their own, like, what is this concoction for you? And you're right. Like there's so many people who just their environment is not conducive. If you're in a town where there's no gyms,
Yeah.
like nobody's gonna work out, right? Like
Yep.
and so just changing that or having some or if you didn't have access to pumping iron as a 14-year-old boy, you're not gonna like have the idea in your brain that this is good for you, right? So there's so many factors, and that's kind of where I want to go. You're obviously, I'm not saying like you public health is something that like barbell medicine, you're trying to put forth messaging that is more I would say nuanced, but also um just I think it's honestly helpful, right? But people don't really look at it that way. But like the agenda on health in the past 6 months has kind of become oh, we're gonna finally make America healthy, and it's gonna be because we're going to make our food supply, or we're gonna take toxins out of XYZ. Uh in like in your frame of mind, because you already kind of mentioned it, right? Like the purpose of the hospital ideally is so that somebody who is acutely ill gets what they need and we get them out of the hospital, right?
Yep.
The purpose of our healthcare system, which is flawed. Like I think we can admit to the fact that like it's a not perfect, but like no system is not to necessarily like make you healthy inside of the system. What we should be doing is figuring out ways to, put more social determinants of health, right?
Mhm.
But those aren't the message, they're nuanced messages, right? They're not like clickbaity and quick. But what are the things that you try to convey as best you can, either through your social media platform or maybe in your teaching to help people think about this stuff better? Like what is the messaging that, like, if you could have half an hour with policymakers, like what are the questions you would ask them, or how would you try to guide them? And I know that that's not necessarily like your
Um,
total domain, but I
yeah,
do
yeah.
appreciate, and I think you have a way better take than 95% of 99% of people.
Yeah, yeah, I agree that not exactly the scope that I would claim as my area of authority, but probably right that based on my understanding of a lot of these things, maybe a more informed take than than lots of folks who are happily commenting about a lot of this
Yeah,
stuff these days.
yeah,
I think that both historically and now we're seeing it kind of reemerge in a lot of the modern discourse revolves around everything coming down to individual decision making and individual choice and individual kind of quote unquote responsibility. And it's not and I wouldn't necessarily argue with the concept that we do bear some responsibility for our, day-to-day, health maintenance and things like that. However, I think it is inaccurate and ultimately a message that is going to be unhelpful slash doomed to failure if all of health outcomes end up getting reduced down to concepts of individual choice and responsibility. That anyone who develops obesity, for example, anyone who, to your point earlier about access, for example, environmental factors relating to exercise, who isn't doesn't meet physical activity guidelines, that it's purely just a matter of individual choice in that situation. Um, I think that that's the message that I would kind of push back against. And what's interesting about some of these nominees, which we won't really get into great
yeah.
detail
You
on
don't
some of
have
them,
to.
but let's say, for example, that they are able to overhaul the modern food industry institute, some sort of regulatory, interventions on the food system, maybe food reformulation, towards more healthful, products and things like that. It's like, okay, I'd be open to seeing what the impacts of that are.
Yeah.
Part of the issue, though, is that they're embedded within a broader, political movement and administration that is going to be fundamentally anti-regulatory. So it's kind of an incoherent position to be taking, right? Is the broader, set of political wins going to allow something like that to get done, or is even the food industry going to let itself be regulated in that way? And so these conversations come up a ton when we're talking about obesity these days, specifically around like medical approaches, therapeutic approaches, surgical approaches to treating obesity, where a lot of folks, oftentimes those who have self-selected for, leanness and things like that, because they're like us, they feel better when they exercise, not worse. They are in a food secure situation. They have the time, energy, effort, and resources to be able to adhere to this kind of lifestyle. And they're like, well, I'm able to stay lean. All you need to do is not eat, and you'll be able to you'll be able to get there too. And in the same way that you mentioned, all of the different variables across not only present time but like your lifetime that coalesce to generate your outcomes, it's similar in this situation where it would be nice if it was just that simple, or that easy for people to do. But I think that, with an issue like obesity and the associated complications of it that we're talking about with this kind of making America healthy, it all has to do with, the vast majority have to do with complications of obesity, diabetes, cardiovascular disease, and oftentimes adiposity, like related cancers and things like that that can emerge, and other complications that, sure, if we could put a huge dent in that, then we would see a significant improvement in population level health. We really only have two options for like the levels of intervention that we can act upon, right? Either it's going to be at the individual level, or it's going to be at the broader systemic level. Ideally, it's both,
Both. Yeah.
right? The tough part with acting at the systemic level is, yeah, it's going to require government intervention. There is little interest for or incentive for, the food industry to self-regulate, self-police, to, get people to eat fewer of their products. That is a nonsensical type of,
There's a McDonald's like 2 minutes away from me. Every
yeah.
time I go by it, I'm like, damn, it would be good to have a cheeseburger, right?
Right.
Like, and that's the hard part about a lot of this stuff, right? It's
Yeah, yeah. And they're
100%.
not interested in formulating a burger that's so filling that you can't even finish one, so you end up ordering half of one,
Yeah.
half of an order, or you split an order for three people or something like that, right?
Yeah.
So the broader systemic factors, those are the ones that are going to be more potent on a population level, but harder to implement, at all. So then, if we're stuck for now more operating on the individual level, the questions are, what can we do, right? We can just wag our finger harder at people and tell them to try harder, which is what we've been doing, shaming people and chastising them and telling them you need to try harder for decades now, which proven track record of not being
Not so good.
successful.
Yeah.
Or we can use therapies that have demonstrated efficacy. This is our more modern anti-obesity medications, our, metabolic bariatric surgery, things like that, which, would I prefer that we not need to use those things to get the population to healthy body compositions and get the maximum? Sure, right? But to the extent that, this is a general concept in all sorts of other areas of medicine, is, you try the more conservative route first in most situations, and if that doesn't, achieve the effect you want, you intensify the intervention. And
Yeah.
so that's kind of where we're at, right? With the
Mhm.
progression. So if I could zoom back out to answer, the initial question posed at the outset here, I think that, the question that would be getting posed to lawmakers is there any willingness to intervene at the systemic level, right?
Yeah.
If there is interest to intervene at the systemic level, we can totally have a conversation about what those interventions could look like. Although I would want to draw in a lot more expertise to help to design what those interventions could look
Yeah.
like. Would it be food reformulation? Would it be like targeted, like sugar taxes that have had actually some success in other countries? What else? What other kinds of interventions have shown efficacy in other areas of the world where they've been tried, or what would be reasonable to try here? If fundamentally the answer is no, there is no appetite for intervention at the systemic level due to this, or industry lobbying efforts, or, congressional gridlock, or whatever the case is, then okay, do you want to do something about this or not? Because our only other option is at the individual level. And I can,
Yeah.
that I'm much more, able to, discuss, in terms of direct experience and expertise on what those individual level interventions can look like. In which case, at that point, it is, how are we going to pay for some of these things as it relates to medical therapies, surgical
Yeah.
therapies, the associated healthcare? Because unless your proposal is to do nothing and to keep you wagging your finger at people, which is what we've been doing for a while now, and we're going to keep seeing the same trends if that's your plan of action.
I do fall into the trap of you got to try sometimes, right? But like, and that's because there's always it's both, right? We need to set people up. If this is like in any realm in life, right? Humans are complicated, like we are complicated social, like even just the pain, the pain, like pain is like a great analogy for so many things because we feel like it's so simple, like something's broken, right? Well, it's like no, it's like there's physical, cognitive, and emotional aspects of this, even inside the greater scope of just kind of the human experience, right? And so I guess where I kind of want to go with this is like, how do you, and that this is just less specific, but like, how do you move forward in life despite the immense complexity of life, right? Like that's kind of something that I don't know if you don't want to get too existential here, but like your job is science based, hopefully, right? With a ton of what we could call artistry. Like, how do you apply physiology and things that, like it kind of always goes back to like the nutrition equation is like, well, it's not calories in, calories out. So we can't escape the thermodynamics, right? We can't escape that, right? But people still want to. But there is also a lot of factors in like how we think about that thing. How do you like move forward as a physician working with complicated stuff? Like what is your decision making criteria? Kind of, I know that's super broad, but like how do you tackle the immense complexity of life?
Yeah, I will answer that in a moment. I want to touch on one thing that you mentioned there
Yeah,
where,
please do.
wanting to make sure that, people try for
Yeah,
example, right? Which
yeah,
I'm on board with that idea, but I think it can be helpful to draw, a slightly different analogy if rather than focusing on obesity, which is like heavily, moralized and stigmatized in all sorts
yeah,
of ways, and that leads to, challenges in this conversation, right? But let's
yeah,
imagine a hypothetical world where instead of the person's body composition, their leanness or degree of obesity having a major impact on their health outcomes. Let's say that rather than, let's say we want you to achieve a waist measurement of 34 inches or something like that for health. Let's say that you needed to deadlift 700 pounds, hypothetically, and that was what was necessary to achieve good health outcomes is you just need to hit 700-pound deadlift, right? How are we going to aim to achieve that in our population? We're going to tell people to try, right? What
yeah,
fraction of people who are instructed to try are going to achieve that outcome, right? It's going to be a tiny fraction because a
yeah,
tiny fraction of people not only have the genetic, makeup to respond to training sufficiently to achieve a 700-pound deadlift, but they have the access, the environment, the nutrition, the all sorts of other variables that can lead to that as a successful outcome, right? And when we look at what proportion of people, achieve clinically significant weight loss and sustain it for 20 years, it's probably on a similar order of magnitude, probably even fewer that would be able to achieve a 700-pound deadlift. But we're talking just general kind of concepts here, right? So a tiny fraction. If then we're faced with this decision of, well, oh my gosh, this tiny fraction of people is achieving our targeted health goal here. How else can we get there? Well, what are your remaining options going to be? Uh, we could start putting people on steroids, medical therapy, right?
yeah.
What
Which people are
effect will,
already doing
yeah,
like
what
crazy.
effect will that have? Well, it will shift a fraction of the population who were unable to achieve that outcome before, and now they will achieve that outcome. This is in some ways analogous to the use of, say, GLP-1 receptor agonists for treatment of obesity, where in a group that gets placebo, maybe you have 5% of people that lose 15% of their weight loss, and the people who get the medicine, maybe 45% of people achieve 15% of weight loss. Just, hypothetical numbers here. This type of data exists for these individual agents and doses. It shifts the curve of response effectively, like rightward, so more people achieve the outcome that you want. There's still going to be a group of people who, despite being on steroids and training are unable to achieve that 700-pound deadlift. But if that is what is necessary in this like hypothetical, Martian world to achieve health outcomes, what are we going to do? Well, maybe we give them like an exoskeleton or something like that so that they
Yeah.
can lift the 700 pounds, right? You intensify the intervention to get
Yeah.
to the outcome that you're looking for. And so that's analogous to the approach as it relates to body composition, obesity related care is yeah, we attempt the lifestyle interventions, but there's a small fraction who'll do great with it, a larger fraction who will respond a bit, but maybe it'll be transient, and then a decent fraction who won't be able to, achieve a sustainable response over the long term. Medical therapy can significantly shift that response. And then surgical therapy on top of that can shift that too. And all this comes down to the fundamental question of like, do you care about the outcome or do you care how we got there? Right?
Yeah.
If you're talking to a clinician, we're going to care about the outcome, right?
Yeah.
Much, much, much more than how you got there, right? There are obviously these conversations rage on the internet all the time where maybe somebody will have an adverse effect from one of these medicines, right? They'll say, I got gastroparesis from one of these medicines. They're evil. Nobody should take them. And it's like, well, I don't see all of these posts about, I see this, 15 times a day in the people that I round on. Oh, I admitted a patient who had a heart attack related to metabolic syndrome and obesity, right? There's the side effect of that we,
Yeah.
could have potentially
Yeah.
prevented that risk, right?
Yeah.
So that's my thought experiment of like, how would you approach it if our goal, rather than to get everybody to a waist measurement of, 31 inches, was to get everybody to a deadlift of 700 pounds? You could apply a similar kind of
Yeah.
mentality to it, and it should make sense. Okay,
Yeah.
so that's
Yeah.
that.
That's helpful. I think that's a really good way to start to frame these conversations that people don't do enough of those types of thought experiments, right?
Yeah,
It's
yeah,
and the morality. I mean, I had a couple clients come and like lift this morning with me. We every Wednesday morning I have a group of ladies and like weight is a sensitive topic, right?
sure.
But I described like I weigh myself every morning. You know why? Because it helps me regulate like that variable for
Yeah,
myself. I've actively the joke I make is I did a starting strength esque bulk right before I got married. I gained like
hmm
40 pounds and like right before I got married. And my wife is like, why did you do this? And
yeah,
then so I'm finally back to basically my pre bulk weight. But the best metric for me has just been to step on the scale.
yeah,
And I have learned to be less emotional about it and more objective. But I said that to them. Like I said, like, yeah, I stepped on the scale. Like, oh, it was post Thanksgiving. I'm like, I gained like 4 pounds. And like, why are you even measuring yourself? I'm like, I'm just doing it to be objective. Like that's all
yeah,
it is, right? And I get why, I get why they have an emotional response to it because it's been ingrained into us that well to some extent you shouldn't measure that variable. It's not your self-worth. And I'm like, I know it's not your
sure.
self-worth, right?
Yeah,
But I digress. So I appreciate that. What was the other thing I asked you?
yeah, yeah. Had to do with just kind of dealing with
Yeah, the
complexity
complexity of
in
all this
general.
stuff. Yeah, yeah,
Yeah, I think that, the longer amount of time that you spend in a given field, you have a chance to observe the just ebbs and flows of opinion and of debate. And if you pay attention to evidence, then you see, how opinions and how things evolve as new evidence emerges in various areas. And that should be a humbling experience, right? So I know going through medical school, now like 15 years ago or so, the stuff I learned, mostly fine. Several things that are now outdated, several things that are actually the opposite now. A lot of treatments that were taught and existed back then that are now obsolete. Um, all sorts of things that has evolved during that time period. You can look at the world of, strength training and performance. I know, I still follow the world of competitive swimming and the debates about, training philosophies and things like that. And so I think that if you just pay attention to how these things evolve over time, ebb and flow, things come into fashion, things go out of fashion, et cetera, that that aspect of it that is humbling in that way should give you a kind of a permanent sense of uncertainty around things, right? And so when I know that all this stuff that I deal with day to day is very complex and uncertain, and I'm kind of appreciative that I'm operating based on my best understanding of things as they stand now, while even in some of the things that I feel the most confident in, um, it's like, well, that is something that could get overturned, in in the near future. And so,
Yeah.
you see in a lot of debates and discussions and arguments, people who are overconfident in their position. Most often, this is overconfidence in the setting of insufficient expertise to justify that level of confidence, which is problematic and frustrating to be involved in those kind of arguments. Part of the reason why, I am a frequent citer and recommender of certain, belief change resources like the guy from Street Epistemology on YouTube, or how minds change,
David
which is a
McCraney. Yeah.
perennial recommendation from
That
me.
book's incredible.
Yeah,
Yeah.
I mean, just the simple exercise of when you're talking to somebody, just like, hey, 1 to 100, how confident are you in this? And then when they pick a number, why not more? Why not less? Interrogating that is such an interesting exercise to do with other people. It's an interesting exercise to do with yourself. And so that's, I would say, my best answer to how I navigate all this complexity is appreciating that, it is complex. It's tempting to make everything very simple. Simple narratives are attractive, right?
Yeah.
And you know, even this topic is tricky because there is some truth. I think it's an old, I don't know if it was a Feynman quote or something where it's like, if you can't explain something simply, then you don't really
Don't
understand it. And
understand.
it's like,
Yeah.
yeah, like I'm an educator. I teach a lot. I can take a concept and scale it up to teach a third-year resident, scale it down to teach a first-year medical student very simply. But my like simple explanation of this fails to capture a lot of what's going on there, right? So
Yeah. Yeah.
even if I do understand something, my simple explanation is only a tiny piece of the big picture. So things are fundamentally complex most of the time, right?
Yeah.
Um, and
It's
just you
always
have
funny
to
to me
accept that.
too. It's always funny to me too because most of those quotes that we attribute to famous people are like aren't really like they never actually said that.
Yeah,
Like,
totally.
so it's like it's just the stuff we just clickbaity kept up over time. But yeah, it's accepting complexity, and I think what you're ultimately getting at, like accepting complexity doesn't mean you can't move forward. Like it doesn't mean you can't take action, right? It actually like what gives us confidence is like taking action despite complexity. And it kind of like I was literally writing about this morning. It's kind of like fuck around and find out. Like that's what we're doing over and over again. And you're just trying to make like being less wrong over time is what you're trying to do, right? And yeah, and then like it doesn't mean you can't make decisions. Like I'm sure in your circumstances, like if you see somebody's blood pressure like this, you're like, here's what we got to do, right? This is the course of action, right? Despite the complexity of the overarching experience, right? It's also just like yeah, people who and I get it. Like it seems really smart. It seems really intuitive. Oh, let's make the food in the hospital healthier. Like, and over the course of maybe a lot of years, that might have some sort of an effect. But like, again, what are we trying to do here? We're trying to make sure people have sufficient calories. We're trying to get them out of here as fast as
Yeah.
possible. We're also in a freaking business where they're trying to make it sure that the food doesn't cost a shit ton of money, right? So like, there's like it's all those factors, right? Um, you talk about. I want to get into like I'm always curious like what your training looks like, but really quick before that, you cover like placebo or what I kind of call belief effects, right? I don't know. Have you ever read The Expectation Effect? I have it
No,
right here. That's why.
I haven't.
I don't know how great of like this is well cited, but it's basically like so many of the effects that we attribute to the drug or the food are actually our beliefs about the thing in our physiology, like manifesting from our beliefs, right? It's freaking blew my mind over and over. And I had been exposed to like I know you put out like the placebo sleep article. I'm like, fuck that, like. Yeah, I kind of shouldn't let it affect me. Like
Yeah.
sometimes it's gonna like if you go, a bunch of nights in a row. I have a newborn, and it's like the first few nights, like I was jacked up and I was tired, but it actually didn't have that much effect on my ability to go physically perform. It was just
Hmm.
I was tired and it
Yeah.
sucked, right? But like talk a little about that when it comes to like pain and evil and kind of performance. What are the things trait neuroticism is something I always like appreciated. Like, oh yeah, like we're being neurotic about XYZ. And I also was like the guy who spent so much time worrying about technique in the early stages of lifting that like I didn't actually gain the performance benefits of just trying hard. Um, with decent technique, right? That's
Sure.
always the freaking
Sure.
thing, right? So, but talk a little bit about kind of managing neuroticism, managing our mind when it comes to training and maybe life.
Yeah. I think that, the resources or the kind of the sources of authority from which we derive our beliefs can have such a huge impact on things here, right? So, there's survey studies, research data in the world of, persistent pain related issues like chronic low back pain that a huge percentage of people in that context have a lot of very negative beliefs about their condition, and that those many of those beliefs are derived from healthcare professionals, that whether intentionally or inadvertently or subliminally, somehow it was messaged that you are in a real bad state and this is a real bad thing and it's real complex and maybe it's going to be difficult to get better if at all. And those kind of influences can have really, enduring effects over time. The same would apply for, the world of training and coaching. If you're a coach and you're working with lifters, the messaging that you give them explicitly or implicitly can lead to a bunch of downstream beliefs and expectations and behaviors that can be helpful and adaptive or very, very unhelpful, right? So setting the belief, for example, that, your knees should never travel further forward than a particular point in the squat because otherwise it's bad for this reason or that reason, that is not helpful for people. In many situations, it's an unavoidable, it's almost a desirable position to be able to access. It might make you hypervigilant, worry about it. It might not even be helpful from a performance standpoint. Some people perform better when they allow that kind of thing to happen. Or if your, spinal segment must be held in absolute perfect rigid extension, otherwise you're going to risk catastrophic, disc herniation or something like that, which is false. It's also impossible to maintain with any appreciable amount of load, even with almost no load at all. There's detectable, flexion going on in people's spines. And so it's kind of this idea of those kinds of messages, when delivered confidently, explicitly or implicitly from a source of authority, can lead to a whole bunch of either favorable, downstream beliefs and expectations or unfavorable ones. And so, a good counterexample to all these negative ones is once, this was several years ago, when I was working, when I was coaching Alan Thrall back in the day, and he made a video about this. He had come down to San Antonio, and we were getting ready to teach a seminar that weekend. And the Friday before, I think it was the Thursday, maybe before the seminar, we went to do our group training session at a local gym. He was doing his deadlifts for that day. He was working up. I think he pulled somewhere in the mid fives or something like that. He pulled 500, whatever. And I saw during one of his reps on that set, he just kind of briefly like hiccuped on the way up. And I recognized it as like, oh, I bet he just like tweaked his back like mid rep. And there was nothing visibly wrong with his execution or anything like that. Wrong in heavy air quotes there. But
Yeah.
I was like, that's a tweak. So he set the bar down and he just kind of stood up kind of rigidly, as you tend to do after that kind of thing happens, looked a little uncomfortable. And, I just very, poker face calmly just said, you just tweak your back or something or what? And he was like, yeah, like, holding
Yeah.
holding his breath, squeeze that out. And so I said, all right, we know what to do with this. Let me walk you over here and we'll just go through what we're going to do some, body weight movements, some like air RDLs, some body weight squat, whatever, stuff like that. And he ended up making a video about this, and he described the experience of how my like utter lack of alarm and reaction to this actually immediately put him at ease and gave him confidence that this was going to be okay. And so that was Friday before the seminar. At the seminar during our breaks, he, the Friday he did some just like air movements. The Saturday of the seminar, I think he RDL'd, 85, 95 pounds, something like that. The Sunday of the seminar, I think he squatted like maybe 185, 135, 185 in that range. And then Monday, before everybody left, they came over to my house. We trained in my garage, and he put up in that video himself squatting 495 pain free on Monday. And I wouldn't generalize this to say like, yeah, everybody can fix their back tweaks in 72 hours. Yet it certainly could have been prolonged if I had said, oh, like I panicked. I,
Yeah.
was very, very concerned. Maybe I like laid him down and started doing a bunch of physical exam stuff on him and
Yeah.
said, we need to take some time off. I need to, deload you. We need to be doing cat cows for the next like 2 weeks before I like reintroduce some light load, whatever the case is. Like I could have made it much worse. I don't know how much, better I, accelerated the timeline can be made, but I think he got as good of an outcome as he could have had. So those are like a couple examples of things going in either direction where particularly if you're in a position of authority to be delivering any kind of messaging, again, explicitly, or as in this case that I described, a lot of it was implicit. Like I didn't
Yeah.
go out of my way to tell him, this is nothing, blowing it off. I said, oh, we know how to handle this, giving that sense of calm and confidence and self-efficacy here that it ended up leading to a fantastic outcome.
You bring up a really good point there about not over overdoing it, which is the typical. It almost seems if you but you also didn't underdo it, where it's
Yes,
like this is nothing, because that can have both of the overdoing and the
totally.
underdoing
Yeah,
can have a negative response, right?
yeah,
That's really the art of like just remaining calm and being like, hey, okay, we can handle this, and this is hey, is this what happened? Because I've probably done both at some point in time. I was like,
sure.
oh, we gotta like, and then like one time I somebody, and it was less like this isn't there's nothing wrong, or this it's not that it doesn't suck, but it's like how you
Yeah,
handle that. That's the tricky part, right? I do want to get into something just rehab and like kind of rehab oriented. I think so much of what I see is like everybody's putting out like protocols, like, hey, this is the stepwise solution to your stuff. And like as a physical therapist, I get the utility of having this stepwise plan. And it's not that that plan is not useful at all, but there's just like a lot of individual variation in the experience. And there's also just like I always just kind of go back to like, well, we're gonna try to grade the exposure based on principles and XYZ. But like the thing I struggle with sometimes is I'm more of kind of a Mike to share like reactive approach, like week to week, adjust variables as needed type of with most things with a goal in mind. But do you feel like the protocol-esque approach to some of this stuff kind of lacks, like it leaves something to be desired for sometimes? Or do you think like is that just the human condition, is like knowing where we want to go and creating
yeah,
that kind of clarity? The
yeah.
the double-edged sword of it is knowing where you want to go and creating clarity is awesome, right? But if you're not responding great for the first 2 weeks and this was the plan, that gives people the sense that like it's like me seeing that 135 to 405 chart in the starting strength book and being like, wow, I can do this in 12 weeks. And then I was squatting
Yeah,
275 and I'm like,
right.
what's wrong with me? And then you go
Yeah.
eat a whole pan of brownies type of shit, right? So
Yeah. Sure. So I think there are two kind of scenarios here. The first is people who put out these kind of simplistic, we're call them quote unquote protocols, just for social media attention because it's easy to put a protocol into a post to lay out simple steps that'll get the post bookmarked, shared, whatever the case is. I'm gonna like
yeah,
ignore those for now because that's not
okay,
really what we're talking about.
yeah,
The other are kind of more, you can call them more formalized protocols for a particular situation. And I don't think that these are bad. The reason is, so I'm going to tie this into something that you just said before. When I was giving my anecdote about how I responded to Alan, it seemed to hit just in the sweet spot, not too much and not too little. And
yeah,
you described your own experience of sometimes doing too much and sometimes doing too little. And now I imagine you're probably better at targeting at the right level, not doing too much and not too little. But all of that is a result of gaining experience to the point where you have a better sense of how to read someone. You've seen this pattern before, this clinical scenario before, and you're better able to adjust and individualize your intervention based on your accumulated experience. But there are going to be a lot of people, especially those who are newer to a field, who lack the experience to be able to make that kind of decision, right? And so if you just put out your clinical practice guideline and your guideline exclusively consists of a statement that says individualize your intervention to the patient, you're welcome. People who are fresh out of school, who don't have experience with this, they're going to be like, well, what does that even mean? I don't know what all the options are. Like I learned some of this stuff in, I learned all these, fancy therapeutic exercises in my class or in my rotation, but I don't know how to individualize these because I've not seen 1,000 cases of, patellofemoral syndrome or, non-specific back pain or post-op ACL or something like that. I don't know what individualized means. They will eventually, but until they have accumulated that experience to be able to comfortably individualize, providing some sort of a non-individualized or perhaps an overly generalized kind of protocol gives people in that situation a starting point, right?
Yeah.
And so this is the same concept that applies in clinical medicine, where we have clinical practice guidelines on all sorts of things. And if you talk to very experienced people in their niche, they will often say, I just read actually a cardiologist wrote something that I read the other day. He said something to the effect of, clinical practice guidelines are super useful for me to understand what people in other specialties do in certain situations.
Yeah.
In my own specialty, I don't pay attention to my own clinical practice guidelines as much as because I'm so familiar with the primary literature in my own field, right?
Yeah.
And so it's not to say that guidelines are useless in your own field, but that was their approach to things. Like, I am intimately familiar with my field so much that the distillate of that in the form of generalized clinical practice guidelines is not how I operate day to day, because I'm able to very in a very targeted way individualize my practice patterns, my interventions based on, well, the patient that I'm seeing in front of me right now looks an awful lot like the patients who were in this particular study that I know, right? Whereas in this other specialty, I don't know shit about that field, whereas the clinical practice guidelines can be a great distillation of that for me to have a general understanding, right? And so I think the same thing would apply here, whether it's in rehab, whether it's in generalized, coaching or something like that, where you have a programming template structure or something like that. It's like, yeah, it's not going to be perfect for everyone, but it will provide people with a starting point, right? So it's no different than me taking, a lifter who wants to start, training for whatever lifting related task. Maybe they want to train for powerlifting or something. And I just tell them, all right, so I'm going to recommend that you start out with a an individualized program that is appropriately dosed with an adequate amount of specificity as well as variation, and is auto-regulated, and that peaks you at the right time for the competition. Okay, cool. Here's your bill. Thanks for your time.
Yeah.
It's like, yeah, that's what we're trying to do, but I don't know how to do that, right?
Yeah.
And
Yeah.
so
That's a
so
good that's a good way of phrasing it.
giving some baseline structure, even if it's not perfect, even if it might actually not end up being great for that one person, if the person guiding the show here, be it the clinician, the coach, et cetera, doesn't have the experience to really individualize things, that can be a useful starting point. And then you can learn through trial and error. Like, yeah, unfortunately, there's going to be some casualties along the way. I've made mistakes with patients that I've managed, and I've learned from those things over time, and I do things differently now than I used to. But that's just the way it has to be.
Yeah. No, that's a very good way of I mean, because it's definitely, yeah, you have to have a starting point. The but where you go is depending on your ability to manage the variables along the way, right? So all right, last kind of thing, because I want to wrap this up. I don't want to take up too much of your time. I do appreciate it, but like, all right, so I'm always curious, like, how the fuck did Austin get so freaking strong, right? And I know the simple answer is like the dude's just been consistent. He like I there's kind of two factors here. It's like what do you think in your brain has like tripped to just like for you to like push appropriately, right? But also at this point in your lifting career, and maybe even at other phases, like are you following like a template, or are you basically going and doing like I think what it seems like you do base is like a lot of top set with back offs, because it's more and more it's kind of obvious that the top set is a great indicator for where you're at on any given day, and then you can apply the appropriate amount of stress with rep ranges and stuff like that, with with that whatever your goals are. You've gotten to the point where you could probably manipulate a lot of things and just intuitively train, right? And then it also seems like you're still going and running and doing other shit that you just enjoy and that's good for you from a health standpoint. But like, kind of talk me through like the mental piece of lifting for you, because you have to. That's the thing. It's like you do have to fucking push yourself. Like you got to
Yeah,
try hard, right?
yeah, yeah.
I think that's one of those things I like. I see it, and I probably get, it's funny because you kind of attract people like you. I attract people who like, I'm gonna get good at squatting by squatting RP 6 over and over again. It's like, no,
Hmm.
we gotta like push you through that a little bit, right? It
Yeah,
doesn't mean you're not managing these variables well, but you got, there's gonna be times where you're not making a perfect call all the time,
sure.
right?
Yeah.
So talk me through that briefly. You don't have to give me
Yeah,
everything.
sure. Yeah, my training's evolved a ton over the years, and in particular, this past kind of 2 years had a lot of like various ups and downs, life, work, personal stuff, things like that. And at the moment, yeah, I'm doing much more of a combo strength and conditioning oriented training rather than more focused on like powerlifting one rep maxes, just because of the sheer amount of time and effort at doing the same thing that it would require for me to PR my deadlift would be just an enormous amount of just like straight deadlift training and stuff like that.
Mm,
I'm not super interested in doing at this moment. Maybe it'll come back, maybe not. But yeah, I think that for strength performance, um, my outcomes combination of yeah, clearly being like a pretty good responder to the type of training that I do. I'm sure that I could have done other programs that I would have responded more poorly to than what I have. Um, but yeah, there's no doubt that getting to the numbers that I've hit at my body weights at the time is indicative of like a favorable, likely genetic kind of response to training. So that's a big part that I can't overlook. As far as the type of training that got me a lot of the best outcomes, it involved relatively frequent training, and which I think is at least as much a preference thing as anything else. Like I like being active most days. I
hmm
probably could have gotten in the ballpark with training a little less frequently if it were more condensed into fewer training days, but I just again like the feeling of being active most days. And in general, at least on the main lifts, yeah, the main setup that I defaulted to a ton was a top set of, usually one or two, maybe three, something like that. And that was usually not any harder than, if you want to get real granular with it, let's call it like an 8.5-ish RPE, somewhere in that range, right?
Yeah.
It's most of the time a load that I could have doubled, maybe tripled if I had to, but definitely could have doubled. And the only way that those types of performances, at least in my mind, are the best indicator of where you're at on a given day is under the assumption that you are doing kind of like the maximum volitional effort kind of thing. Like you're
Yeah.
trying to move the bar as quickly as possible. I think that does two things. It both gives you a more accurate sense of where you're at on that day, and it gives you a better training effect. Like trying to move weights concentrically as quickly as you can, even if they don't move that fast, but trying to gives you better strength training outcomes. So that's the two reasons that I use that. Sometimes, like my earliest warm up, I wouldn't try to like accelerate 70 kilos all that much, but I'm like, okay, I have some indicator weights and I'm starting to pay attention a little bit more. Like once I'm higher than, let's say, 220 kilos, 250 kilos, 275, whatever, if I'm into the 300, like those, I'm trying to move those as quick as possible. Because if I don't, then I'm going to be like, well, is that my cap today, or is there more room to go? So that's one. And then for my back off work from there, I tend to, there's this is, I think, through trial and error what's worked the best for me, and knowing that this is, for example, a bit different than my colleague Jordan, who in general tends to train a bit heavier and a bit closer to failure, whereas I tend to train a bit further away from failure in general. And despite that, despite our years of training, we've ended up like it's very odd that all of our PRs are like probably within about 10 pounds of one another. But just through broadly overlapping training approaches, but with that being like a notable difference, right? So if I do a single at like a 7 RPE, it would not be unheard of for me to pull a whole bunch of triples or sets of four or something like that, like at 25% off of that, which is putting you now into the range of like around 70% or something like that, right?
Yeah.
Um, that would not be unusual. And each of those sets and each of those reps, similarly, I'm trying to move as quickly as I can. So, I might do a workout of, 700 for a top single and then pull 500 for, 5 sets of four or something like that. And each of those sets, it's like there's not a chance in hell I will ever power clean 500 pounds, but it's like almost like I'm trying to
Yeah.
on each of those reps. And so that would be, not an unusual workout during the time when I kind of built my peak strength. And I'd be having usually, like 2 exposures like that per week on each. So I would have done something like that twice a week on once a sumo deadlift, once a conventional, 2 different kinds of squatting, 2 different kinds of benching, and then the rest of the days and slots would have been filled in with various accessory work, which Yeah, I know there's a lot of people who are big fans of, saying you should take your accessory work like super seriously and push it to failure and all that kind of stuff. And that just ain't me. Like I'll put my mental energy and effort into accelerating my squats and pulls and benches and stuff like that. Um, I do accessory work. I certainly don't neglect it, but when I do it, I just kind of do it because it's a bit of some pump work. It's some extra stimulus for a particular area. I don't I ever take my accessory work to failure pretty much just because training to failure, I have found for myself, is not something that I prefer, not something that I respond very well to, and tends to piss things off and precipitate some tendinopathies and aches and pains that just ain't worth it to me. Um, so that's kind of the big picture of what my best strength training kind of outcomes looked like when I was doing stuff like that. And to your point, people who want to build their peak strength, using RPE 6 squatting or something like that. It's like, well, if you're trying to accelerate every load as much as you
Yeah.
can, trying, and you're actually appropriately scaling the load to maintain the load at that RPE, it's
Yeah.
like you can build a lot of strength doing that, right?
Yeah.
Is it going to build you the biggest 1 rep max? No,
No.
because doing a true 1 rep max is a unique skill that requires you to be able to recruit everything for 1 rep and potentially move at a much slower bar velocity and things like that. So there's some unique demands on that you need at least some exposure to. But
Yeah.
you probably don't need a ton of exposure to it. Like in general, you probably need less exposure to that peak intensity than you think, and you can probably accumulate more of your volume further away from it, assuming that on those sets, even if they're stopped well short of failure, you're trying hard on on all
Yeah.
of them
Yeah.
as
Yeah.
the
Yeah.
as the unique variable there.
Yeah.
And then aside from that, these days, yeah, I'm doing a bunch of conditioning. Either, I'm running anywhere from once or twice a week, all low intensity. I'm not doing any sprints because strength training is already interval training effectively, right? Sets and reps at high intensity. So all my
Yeah.
conditioning these days is pretty much lower intensity stuff. So either the run or on the Concept 2 rower or on like a recumbent bike. And then sometimes, my wife pulls me along to go play pickleball, which can be fun too. So
Pickleball's
just
fun.
moving in
Yeah.
different ways. Yeah.
Yeah, I love it. I mean, you've got a lot of reps on your belt, and there's a ton of nuance in that, and that's the thing. It's like that's where the experience of tons of experience, tons of figuring out what you enjoy, what you're willing to push
Yeah.
hard on. I will say I've been running more sprints, and it's been fun. Like I played rugby in college, and I went back to playing rugby at like 34 years old after like not running, not
Yeah.
sprinting, and
Sure.
I got like I was way stronger, which felt good, but like I was just like popping my calf every other
Yep.
week and just and so but yeah, I think that's the thing. It's like you want people to stay in the game long enough to find stuff that they enjoy and are willing to do what to meet activity guidelines with, right? So yeah, no, this is a super good conversation. I appreciate you a ton. I don't want to take any more time your time, but this was awesome and nuanced as per usual. Where can people find you in any arena? Instagram, where else?
Yeah. Search for barbell medicine, and my name as well as the names of my colleagues will show up. Can't miss us.
Sweet. Yeah, follow Austin and appreciate your time.
Yeah.
Have a good, I'm sure December is probably crazy in the hospital, but take care of yourself over the winter. It's
I'm
probably
ready
always
for what they
crazy.
throw at me.
Yeah, that's a good way to be. All right,
All right,
man.
man.
Appreciate you. Have a
Yep.
good day.
You got it. See ya.
Peace.